Hi, my name is Sofia Correa, and today I'm going to talk to you about the hemicraniectomy in older patients with cerebral artery stroke. We're going to start with some definitions. What is a craniectomy? A craniectomy is a neurosurgical procedure that involves removing a portion of the skull in order to relieve the pressure that's underlying in the brain. Usually, it is done in patients with a significant amount of bleeding or excessive swelling. But you have to know the difference between a craniectomy and a craniotomy. A craniotomy is when you remove a portion of the skull and then you replace it back. The difference is that in a craniectomy, you don't replace back the portion of the skull. In fact, it is sometimes saved in several parts of your body, including the abdomen, in the fatty tissue, so you can preserve it in your own body. The reason why you don't put it back in your skull is because your brain is too swollen to fit it in. Here is a video that tells you more about a craniectomy.
Your doctor may recommend a craniotomy or craniectomy procedure to treat a number of different brain diseases, injuries, or conditions. Your skull is made of bone and serves as a hard protective covering for your brain. Just inside your skull, 3 layers of tissue, called meninges, surround your brain. The thick outermost layer is the dura mater. The middle tissue layer is the arachnoid mater, and the innermost layer is the pia mater. Between the arachnoid mater and the pia mater is the subarachnoid space, which contains blood vessels and a clear fluid called cerebrospinal fluid. Blood vessels, called bridging veins, connect the surface of your brain with the dura mater. Other blood vessels, called cerebral arteries, bring blood to your brain. Inside your skull, normal brain function requires a delicate balance of pressure between the blood in your blood vessels, the cerebrospinal fluid that surrounds your brain, and your brain tissue. This is called normal intracranial pressure. Increased intracranial pressure may result from brain tumors, head injuries, problems with your blood vessels, or infections in your brain or spinal cord. These conditions put pressure on your brain and may cause it to swell or change shape inside your skull, which can lead to serious brain injury. Your doctor may recommend a craniotomy to remove abnormal brain tissue, such as a brain tumor, a sample of tissue by biopsy, a blood.
So that's more about craniectomy. Now we're going to define what is a stroke. A stroke is the loss of the brain function due to a disturbance in the blood supply to the brain. This disturbance is due to either ischemia, which is the lack of blood flow, or hemorrhage.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via 2 major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow.
So, continuing, this was a study done by the New England Journal of Medicine. I'm going to tell you a little bit about the method that they used. They assigned 112 patients from 61 years of age going up. The median was 70 years, the range was from 61 to 82. They all had a malignant middle cerebral artery infarction to either conservative treatment in the intensive unit care, which was the control group, or the hemicraniectomy. After they did this whole method, the results, they found that in the hemicraniectomy, it improved the primary outcome. The proportion of the patients who survived without the severe disability was 38% in the hemicraniectomy group, as compared with the 18% in the control group. However, the infections were more common or frequent in the hemicraniectomy group. And they came to a conclusion, which was that the hemicraniectomy increased survival without severe disability among patients of 61 years of age or older with a malignant middle cerebral infarction. The pros and cons. The good things about this procedure is that it alleviates the disease, it reduces the pressure in the brain. It also improves the chances of survival in a life-threatening situation. So this procedure is usually done in an emergency situation, but there is also a high risk of infection and excessive bleeding with a craniectomy. A related disease, an aneurysm. An aneurysm is an abnormal widening or ballooning of a portion of an artery due to the weakness in the wall of the blood vessel. Here's a video of an aneurysm.
It's 5 o'clock. Your heart pumps blood to your brain through blood vessels in your neck. These blood vessels, called arteries, branch into even smaller arteries that bring blood to your brain cells. Some of these small arteries join each other.
Anyway, continuing, what are the causes of an aneurysm? These are usually a result of a weakened blood vessel wall and can be a result of a hereditary condition or an acquired disease. Aneurysm can also be a nidus for clot formation, a thrombosis, or embolization.
Well, many patients ask what causes an aneurysm. What we know is that it's a combination of a weak spot in the blood vessel that may be there at birth or may develop over time. Usually it's based also on some flow patterns where the flow in the blood vessel hits the wall. And often the aneurysm formation is associated with certain things that patients are exposed to later in life, like hypertension or smoking is a big risk factor. There are several factors that come into play that can cause a patient to have an aneurysm. One is family history or genetics. Another is environmental exposures. And environmental exposures such as high blood pressure or smoking fall out of most series as being very significant in forming aneurysms. So there are some things patients can do to prevent future aneurysm formation and rupture, and some things that they can't control, such as their genetic heritage. But quitting smoking is a major thing that you can do to prevent an aneurysm from forming, or if one is already formed, prevent it from growing and rupturing in the future. Most patients that are discovered to have an aneurysm have many questions, like is it inherited? Do I have to have my family members or children screened? It turns out that if patients have 2 or more first-degree relatives, like brothers, sisters, parents that have aneurysms, then their chance of aneurysms goes up.
So we see it's also an hereditary disease. What about the symptoms and the treatment? If the aneurysm occurs in the body surface, the pain and the swelling and a throbbing mass is often seen. As if it occurs in a deeper part of the body, it is usually asymptomatic. And the treatment depends on the size and the location of the aneurysm.
People who suffer a ruptured brain aneurysm or subarachnoid hemorrhage can have 1 or more warning signs, including what's often described as the worst headache of your life.
So the warning signs are severe headache, nausea and vomiting, stiff neck, blurred and double vision, sensitivity to light, and the loss of feeling in the parts of the body.
1 or more parts of your body. Often, though, there are no detectable warning signs. The aneurysm suddenly breaks, the patient may immediately lose consciousness. In severe cases, the patient may die right away.
So as you see, it can be fatal. Thank you.